Hello, my friends, my family, and my fans. I am Andrew Ditch. I have been diagnosed with autism and intellectual disability. Today, I want to talk about a really important topic. This is very important for millions of other adults with autism. This topic shows how incompetent the medical and mental health field really is. You go to a doctor when something bothers you, like when physical pain, stomach problems, or even when your behaviors are not seen as the social norm. This is where I start with how incompetent doctors are in identifying autism and intellectual disability, and how they often can use masking as a way to misrepresent someone's behaviors as non-compliance or argumentative rather than part of their intellectual disability or developmental disability. Not being believed or taken seriously. You seem fine. Masking, scripting, or using technical language leads clinicians to underestimate distress. Pathologizing self-advocacy. Asking questions, bringing notes, or challenging inaccuracies can be labeled as rigid, oppositional, or personality disordered. Below is a deeper, clearer explanation of these two barriers. Not being believed and pathologized self-advocacy, because they are among the most painful and commonly reported experiences autistic adults face in mental health care. They're not misunderstandings. They're predictable outcomes of a system built around neurotypical assumptions. Not being believed or taken seriously. You seem fine. This phrase shows up in almost every autistic adult story. It reflects a clinician interpreting surface presentation instead of internal experience. Why clinicians say this? Masking hides distress, scripting makes communication appear smooth, technical language sounds in control, calm tone, or flat effect is misread as emotional stability. Articulation is mistaken for insight or wellness. What clinicians miss? Autistic emotional expression often doesn't match internal state. Distress may be communicated indirectly or through behavior. Shutdowns and meltdowns are neurological, not choices. Autistic people often downplay symptoms to avoid being dismissed. Real-life impact. Depression is minimized. Suicidality is not taken seriously. Trauma is overlooked. Burnout is misdiagnosed. People are denied services because they sound too capable. Autistic adults stop seeking help because they expect disbelief. The mask becomes the diagnosis. Pathologizing self-advocacy. Autistic adults often prepare carefully for appointments because they know they'll be misunderstood. They bring notes, ask clarifying questions, or correct inaccuracies. Instead of being seen as responsible or engaged, clinicians may interpret this through a deficit-based lens. How self-advocacy gets pathologized. Asking for written questions, rigid, bringing notes, obsessive, requesting sensory accommodations, demanding, correcting misunderstandings, argumentative, asking for AC acceptance, refusing to cooperate, challenging inaccurate assumptions, oppositional, explaining needs in detail, overly intellectualizing, requesting time to process, avoidant. Why this happens? Clinicians expect neurotypical communication. They misinterpret directness or precision as hostility. They assume autistic people lack insight. They view requests for accommodations as resistance. They rely on stereotypes about rigidity or behavior problems. Real-life impact. Autistic adults are labeled with personality disorders. Their credibility is undermined. Their needs are dismissed. They are punished for trying to communicate clearly. They mask more. Worsening burnout. They lose trust in providers. Self-advocacy becomes evidence against the person. Glowing star, the core insight. These two patterns, not being believed and pathologized self-advocacy, are not isolated issues. They are the direct result of lack of autism-specific expertise, competence bias. You sound smart, so you must be fine. Behavior-focused interpretation, neurotypical expectations for communication. Stigma around autistic emotional expression systems that reward compliance and punish difference. Autistic adults often say the same thing in different words. The more clearly I explain myself, the less seriously they took me. If I mask, they think I'm fine. If I unmask, they think I'm unstable. If I advocate for myself, they think I'm oppositional. These are systemic failures, not personal shortcomings. in daily life and systems navigation, executive function and bureaucracy, forms, portals, and phone trees. Complex scheduling systems, online portals, and paperwork are major barriers when executive functioning and processing are already strained. Follow-through expectations. Systems assume the person can track appointments, refills, and authorizations without support. Fear of punishment or loss of autonomy. Childish treatment or guardianship threats. Some adults fear being treated as incompetent or having guardianship or restrictive supervision imposed if they disclose mental health struggles. Police involvement. Past experiences of crisis responses involving law enforcement make people reluctant to seek help early. Below is a deeper, clearer, and more connected explanation of the daily life and systems navigation barriers autistic adults commonly report. These aren't small inconveniences. They are structural obstacles that shape whether someone can access care, stay safe, and maintain autonomy. I've expanded each point so it captures the real-world impact, the emotional weight, and the systemic roots behind these challenges. Globe with Meridian's daily life and systems navigation barriers for autistic adults. Autistic adults often describe that the hardest part of getting support isn't the therapy itself, it's everything around it. The bureaucracy, the communication demands, the assumptions about independence, and the fear of being punished for asking for help all create a system that is nearly impossible to navigate without support. 1. Executive function plus bureaucracy, a perfect storm. Forms, portals, and phone trees. Most systems assume the user can navigate multi-step online portals, fill out long, complex forms, make phone calls, wait on hold, follow automated menus, upload documents, track multiple logins and passwords. For autistic adults with executive function disability, processing delays, phone anxiety, sensory overwhelm, difficulty with multi-step tasks. These systems become barriers, not pathways. Real-life impact. Missed appointments, lost services, denied applications, incorrect paperwork, overwhelm that leads to shutdown avoidance because the process itself is too hard. The system interprets this as non-compliance or lack of motivation, when in reality, it's accessibility failure. 2. Follow-through expectations. Systems assume independence that isn't there. Most programs assume the person can track appointments, manage refills, request authorizations, remember deadlines, follow up on referrals, keep paperwork organized, navigate insurance rules. But autistic adults often need reminders, visual supports, help breaking tasks into steps, someone to assist with scheduling, support with executive function tasks. Real-life impact. Medications lapse, referrals expire, services close, cases for lack of follow-through. People are blamed for not trying, crisis escalates because routine care wasn't accessible. This is a system design flaw, not a personal failure. 3. Fear of punishment or loss of autonomy. Many autistic adults have learned, through experience, that disclosing mental health struggles can lead to loss of rights, not support. Childish treatment. Adults are spoken to as if they are children, incompetent, unable to make decisions, too emotional or too literal to understand their own needs. Guardianship threats. Some adults fear being declared incapable, being placed under guardianship, losing control over finances, losing control over medical decisions, being forced into restrictive supervision. These fears are not hypothetical. They reflect real patterns in disability and mental health systems. Real-life impact. People hide symptoms, they avoid seeking help, they mask harder, they downplay distress, they wait until crisis to ask for support. The system teaches autistic adults that honesty is dangerous. 4. Police involvement. Trauma that shapes future help seeking. Autistic adults often have past experiences where crisis teams called police instead of providing support, shutdowns were misinterpreted as non-responsive, meltdowns were misinterpreted as aggression, distress was treated as a threat, they were restrained, handcuffed, or hospitalized, they were criminalized instead of helped. This is especially dangerous for autistic people of color, non-speaking autistic adults with intellectual disabilities. Real-life impact. People avoid calling crisis lines, they avoid telling clinicians about suicidal thoughts, they avoid ERs, they avoid mental health systems. Entirely, they wait until things are unbearable. The fear is not irrational. It's based on lived experience. Glowing star, the core insight. These daily life barriers are not minor frustrations. They're structural obstacles that block access to routine care, increase burnout, increase crisis risk, undermine autonomy, punish honesty, reward, masking criminalize distress, push autistic adults into crisis systems instead of preventive care. The system assumes a level of independence, communication style, and executive function capacity that many autistic adults do not have, and then blames them for not meeting those expectations. This is why autistic adults often say, the hardest part isn't the disability, it's the system. If you're interested in disability topics such as treatment, support, accommodations, and rights, like this video and subscribe for more inclusive content. I will talk to you on my next video.